My name is Bridget Bello, and I'm the CEO and publisher of Tampa Bay Business and Wealth. And I want to thank our sponsors and our panelists, NextPath, Insperity, Largo Medical, Luminary Global, and Stonehill Innovations. This is by far, obviously, the topic that everyone wants to talk about right now. We've been averaging anywhere from 90 to 110-ish people, and this one was upwards of 120. So I got to say thank you also to all of you who have shown up. There's some new names on the list and an interesting South Florida representation, which we haven't been able to figure out, but welcome, and we're happy to have you. It's also the first time that I am not moderating. This is, I think, our 5th one. And I get to hand the reins over to somebody else and actually listen and enjoy this. So I'm going to hand them over to Stephanie Markese. She is with NextPath. They've been an amazing partner, and we appreciate them very much. And she's going to do a wonderful job, and I'm going to get to sit back and hang out and enjoy the conversation. So Stephanie, take it away.
Thanks, Bridget, and thanks, Jason. Thanks so much for having me today. Like Bridget said, I'm Stephanie Markese. I'm VP of Client Services here at NextPath, also one of the founding partners. We are a full-service recruitment firm. We focus on sales, marketing, technology, pretty much anything technology related. And I'm super excited about the panel today and the topic because I feel like this has been kind of, you know, what everyone has been wondering. What's it going to be like whenever we go back to work? I have clients every day that ask me, how are we going to interview? How do we onboard new employees? What are some of the best practices for returning to work? So very excited. And there's so much uncertainty and questions around just everything that's been happening. So I feel like today we're going to be able to have a lot of these questions answered and go back to work with confidence and get back to our new norm. So I appreciate it so much. So we'll jump right into it and we'll get started with our panel. So the first question would be for Troy Atlas. If employees are able to work from home, would you encourage employers to allow their staff to continue to do so?
All right. Well, I guess before I answer that, I should introduce myself. So I'm Troy Atlas. I'm with Stonehill. Stonehill is a strategy and innovation consultancy where we help the world's most interesting brands identify opportunity, create change, and accelerate growth. And we do that by consulting our clients on a range of issues like organizational development, process engineering and improvement, strategy development and implementation, and customer experience optimization, employee engagement. So although we have some medical folks and HR folks on the line as well, I'm going to be focusing sort of on that last part of customer experience and employee engagement is the lens which I'm going to try to answer a lot of the questions today. Because I'm thinking in terms that much like 9/11, when travelers were very understanding of long security lines at airports for a while after 9/11, a few months later, their patience began to erode into frustration. So you got to sort of think in terms of short-term and long-term. So when you talk about, having employees, come back, would you encourage employees to come back or continue to encourage them to stay home? I'm not sure if it's a question as much of ability as it is of effectiveness. Assuming an employer can provide a reasonable level of comfort that the workplace is safe and clean, I think the real question is how well can an employer manage their employees and measure productivity? Professional services can be managed by monitoring billable hours. Salespeople can be tracked using a CRM like Salesforce. But what about operations? What about customer service? It's also a question of employers' policies and expectations. Are employees expected to come into the office at least a couple of days a week? If so, how will that be managed? From a workspace standpoint, from a job requirement standpoint, as well as one of clearly standardization. I think these are all questions employers need to consider, and the answers depend on the type of businesses they have. And by the way, I'm old school enough to think that Zoom calls and even conference calls are fine, but it's very difficult to hear over technology when people will talk on top of each other. So it just doesn't compare to in-person meetings. So I think at some point, employers will need to have employees come in, even if it's just occasionally.
Thank you, Troy. I think that, is very important just to keep in mind. Next, we're going to go to Dr. Christos Politis. Dr. Chris, should there be a mandate for face masks once the employees come in?
Well, thanks for the question, Stephanie. So my name is Dr. Christos Politis. I'm the Chief Medical Officer at Largo Medical Center, the 3-campus system, along with the residents that are at this facility. Also, I used to be a CMO of all the HCA hospitals in Hillsborough County, and prior to that, I was a practicing surgeon in downtown St. Petersburg. So one of the things I want to spend some time on the Zoom conference call today is to provide a clinical perspective with any questions you may have, as well as provide some support for any infection control concerns or protocols that you may be interested in for your business as you open everything back up. So face masks, it's an interesting topic. I was actually down in Miami a week ago, and actually Fort Lauderdale, and everywhere I went, everybody was wearing a face mask. It was actually very unusual not to see someone without donning something, around the nose and the mouth. And then I come back to Tampa Bay, and it's frankly the complete opposite. You'll see it here and there, but it's not very common. A lot of that probably has to do with the fact that the COVID density is much higher in South Florida than it is here. But it's interesting that in the same state you see that kind of discrepancy. So first and foremost, what do face masks do? Why are they even important? So it's important to note that when you have a face mask on, it's not really intended to protect yourself. It's really intended to protect the people around you. So if you cough, sneeze, it'll minimize the droplets that are released. And also when you're generally talking to someone, you probably don't realize it, but you will have some saliva that essentially escapes, and it does have a trajectory between 4 and 6 feet. So by having a face mask, you're preventing that type of transmission. So that's really the purpose of the face mask. In regards to should it be mandated or should you recommend it for your business, it really depends on the kind of business you have. If you have a lot of one-to-one interactions, it's probably a good idea to have a face mask policy to prevent any type of transmission. If you have a lot of independent offices, probably not as important. It's probably not needed at that point. If you have a big group of individuals where you have individual spaces, but certain common areas, it may be a consideration to put a face mask policy in order just in common areas so that you minimize any type of risk. So I think what we'll see here in Tampa Bay is a slow evolution. I think it'll probably start to pick up steam as the summer progresses, but especially for businesses with a lot of personal interactions, it's probably going to be a good idea to consider face masks.
Thank you, Dr. Chris. Very good to know. I will definitely remember that whenever I'm going out and back to work. Next, for Taylor Queen, if someone doesn't want to come back to work, what is the recourse?
All right, yeah, thank you, Stephanie, for the question. So just to introduce myself, my name is Taylor Queen. I'm a senior HR specialist with Insperity. For those of you unfamiliar, Insperity is a PEO, so we provide HR services to small to medium-sized companies. So what to do for an employee who doesn't want to come back to work? These are questions I'm being posed to a lot lately with my current clients, and it depends. What I'm recommending at the moment is being as flexible as possible with your return to work plans. For instance, if you have an employee who flat out refuses, ask them why. It's quite possible that the reason they can't come back may be protected under the Americans with Disabilities Act. They may need some sort of reasonable accommodation that an employer is still recommended or still has to follow during this time frame. There's also the, if your company is 500 employees or less, we still have the emergency paid sick leave laws that are in play. We still have the emergency FMLA law that's in play. So if the employee is unable to return because their child's school is closed, they still are eligible for that time frame until December. So communication is going to be king right now for all of these types of scenarios. And really the first thing you need to do is talk to your employee, find out why they can't feel that way. If for some reason you talk to them, they come back and it's not any sort of protected reason for wanting to come back, it's personal preference, things along those lines, we do have some flexibility there in forcing the employee to come back. But on the flip side of that, if you try to force them to come back, they may choose to quit in that time frame. So empathy will be very, very important here.
Thank you, Taylor. I think that's, so good to know, because like you mentioned too, not just maybe in a compromised immune system or something like that, but kids as well with childcare. That's another reason. So definitely good to keep in mind. Next, I want to ask Valerie, because having cleaners come into our office and obviously having to be more aware of cleaning our environment and keeping that sanitized. Do we have an obligation to have our cleaners come into the office more often? Once people return, how would you address that, Valerie?
Thanks, Stephanie, and thanks for having me, TBBW, today. Well, first, I guess I should introduce myself. Valerie, Lavin, the CEO of Luminary Global. We provide pre-hospital products and emergency preparedness supplies. But beyond supplies, we also help our customers with preparing their spaces for emergencies and safety. So, as far as having cleaners come in more often, I believe employers have an obligation to clean their spaces. More or less, it just, I think, depends on the traffic of that office space, kind of like what Dr. Chris was talking about. But then, we gotta ask, what links are we going to be expecting our employers to clean and decontaminate and disinfect and sanitize? What's the impact going to be on that business as far as monetary, the extra time it's going to take? If it's a 24-hour operation, how are they going to work around that? And then I think that there's going to have to be, and we're all doing this for the first time, we're all in it together, right? We have to find some kind of happy medium between what will be normal for that workspace and our intensive efforts, like one of our customers, Pasco Sheriff's Department, is using our products to do all 85,000 square feet of their facilities, and along with approximately 200 patrol cars daily. And then, they have a maintenance plan. They're following the CDC guidelines for plan, implement, and maintenance. But not all work environments need to be that intensive, because their traffic is a lot less. So, I just think that the leadership of that organization really needs to get together and plan and determine what's best for their offices.
Thank you, Valerie. Very, very good to hear about that. And I feel like, knowing how to sanitize and having it safe for people to come back is very important. Troy, do you want to add on to that?
Yeah, because I think it not only goes beyond, the type of protection, the level of sanitation that is provided, but it's also how it's communicated. We're kind of talking about empathy. I received, as a customer, I received emails from airlines and hotel chains talking about their enhanced cleaning procedures, including how many times per day things are cleaned for planes, how they're sanitized overnight. In absence of adequate testing and contact tracing, businesses certainly need to follow the guidelines provided by officials, but beyond that, they need to provide a level of comfort to the customers, employees who are entering a business. So I think there should be signage that lets people know the business's cleaning practices, as in how frequently they clean, as well as maybe plenty of hand sanitizer around and face masks on hand for people to use. It's about creating comfort and understanding how the employees and customers feel as they walk into the business place.
No, great point, Troy. Thank you. So I'm just going to open it up. What should be our biggest concern when returning to the workplace? What should we be thinking about? What should we be concerned about? Dr. Politis, do you want to?
Sure. Yeah. So I was just trying to give it some thought in regards to the different types of businesses and the types of concern each business would have. So, you know, the way I see it is there's two components, right? There's your employees and then there's your customers. Now, how do you make sure that both entities feel safe when you open your business back up? And you as a leader, what should you be thinking about as you open everything back up to ensure that that occurs? Now, from your employees' perspective, just making sure that your business is prepared to address any type of concerns the employees have. So making sure your disinfection protocols are in place, making sure that you communicate your policies regarding disease prevention to your employees is incredibly important. Whether it's ensuring that you minimize contact in common areas, you eliminate buffet line food during your breaks, things like that, and making sure you have appropriate signage. In regards to your customers need to know that when they come into your facility, that you've taken all the appropriate precautions to ensure that, you know, they're being kept safe as well. So if you're a closed retailer, when they come in, are you providing a hand sanitizing station to the customers as they walk in, so they sanitize their hands when they come in and also when they sanitize on the way out? Do they see the employees wearing face masks so they know that, you know, the business owners taking serious mitigating the risk transmissions that they would be concerned about? So those are some of the things that I think as a business owner you should strongly consider as you get ready to come back.
Thanks, Dr. Chris. What should we be concerned about as far as like shared items like microwaves or water coolers? What are some things that, you know, companies should think about there or take extra precaution to prevent any sort of, you know, germs or whatever people might be concerned about with the shared items?
It's funny you ask that. It kind of goes along with what I was thinking earlier. So simple things like, you know, your water fountains. So here at the hospital, we've had to turn off all of our water fountains. So those are no longer available. Coffee machines, we switched to single-use Keurig-like machines with pods as opposed to the traditional coffee pot. In regard, you know, we have a lot of nurses station where we had, you know, a lot of restaurants donate food. So we went from traditionally having kind of like a buffet style where you dropped off food and in a common break room, everyone came in and picked up food and made a plate and went ahead and ate. Well, that has to be eliminated. You have to go to individually wrapped, single serve food items. And then simple things like a lot of times people will have shared coffee mugs, shared plates in break rooms. You're going to have to get rid of all of that, and you're going to have to bring in paper plates and disposable silverware. So those are some of the things that you kind of have to keep in mind when you come back in regards to shared service items.
Thanks, Dr. Chris. Anyone else want to add to that?
Yeah, I can add to that a bit. One thing I'm recommending to all of my clients right now is stagger your breaks. So if you've got especially one smaller break room, you have full authority to tell people when they can take those. There are some state laws out there, but generally speaking, you have the authority to tell them, okay, you guys are going to go here, divide them up into groups, and just, you know, as some of the others have said, try and clean as much as possible in between them. Really drive home with the employees to really clean up after themselves, providing, you know, like Clorox wipes, things like that in your break room areas.
Great, Taylor. I think that's, you know, great to think about. Something that you don't really like, you know, think about coordinating your breaks and stuff, you know, until now. So that's a good point. And actually, I just got a good question from someone. Where, like now with all the shortages, where do you even get hand sanitizers and masks whenever it's hard to find them anywhere? Where's the best place to go for that?
I can take up that a little bit. You know, it is so hard right now to find those kind of items. As a matter of fact, this morning I was panicking. I told my husband, I was like, holy cow, we only have 4 more rolls of toilet paper left. And I think that if it's hard to get toilet paper, you can imagine suppliers like myself trying to get these kind of items that are priced reasonably. you know, like with the hand sanitizer, a lot of it's coming over, unfortunately, from overseas, and it can't be flown because of the high alcohol content. So if something that might have taken 5 to 7, maybe 10 days to get here is taking 30 days or more. The shipping cost is fluctuating so rapidly every 4 to 6 hours that we're having a hard time even managing budgeting for the shipping cost. So I think that just really being vigilant in monitoring the suppliers that you normally do business with, seeking out other suppliers to see if they have quantities that are available. Just really being cautious of the price. You know, I know everything is has been increased because of this, but making sure that it meets all of the guidelines, you know, 60–70% alcohol, and then it's FDA approved, and you know, all that kind of things. It's really important to pay attention to.
Thank you, Valerie. Another question, how would you handle, and I'll point this at Troy, but how would you handle a situation where an employee feels that something has been blown out of proportion or believe they don't have to observe these safety measures?
First, I want to say, you know, I'm also looking at this chat feature, and it's like passing notes in class. So it's very funny, but also very distracting. So how do you handle a situation where an employee kind of feels this blown out of proportion? That's a tough one. You know, people's reactions to this lockdown have sort of been like on a bell curve. You know, at one end, you have people who are still afraid to leave the house right now, and you know, even under the relaxed orders. And you have others who felt this whole thing to be a hoax. So in the end, you know, it's about making people who are sort of in the middle of that curve feel safe. So perhaps we should maybe I should be sort of putting this back to our HR expert, Taylor, on the call, but I've spent enough years in the corporate world to know that you need to treat all employees consistently. You have to have written procedures and policies that state what the work requirements you have. If it's a written policy, if it's a job requirement, that all employees, you know, follow those procedures. Maybe it's like wearing masks. There's room to take disciplinary action for employees who disregard policy, but that's where your skill as a manager comes in. Is convincing. You have to convince employees in that polite, gentle yet convincing manner that it's not as much about the safety of the one employee, which Dr. Chris mentioned before. It's about, you know, making the others feel safe, like a safe environment for those coworkers.
Thanks, Troy. Got a question from Jose that I want to bring up, and I'm going to leave this open to whoever wants to answer. But does responsible social distancing become a sexual harassment-like event where it's the receiver field versus the sender? So, you know, I guess that's kind of a touchy situation, just, you know, social distancing, if someone feels comfortable or not. So I'm going to let someone, you know, speak up, you know, what they feel about that.
I don't want to touch that one.
I would love for Jose to answer his own question.
I can jump in on this one. I may be misinterpreting the question. As far as the sexual harassment claim being brought up for following social distance guidelines, I mean, I can certainly see a scenario where that may happen. I have trouble seeing, you know, merit behind it in the event that we were to launch some sort of an investigation to look into it further. For instance, if they were an Insperity client and we did an investigation to see if there was merit to this, it really comes down to the impact of each individual on how if they truly felt that it was sexual harassment. So it's one I'm just having a little trouble wrapping my mind around from a social distancing guideline, how someone would view that as sexual harassment. So it's a little harder for me to answer that without, you know, being able to dive kind of a little deeper into it.
I don't interpret his question as, and maybe I'm wrong, as sexual harassment, but he's just using that kind of as an analogy, you know, like with sexual harassment, sometimes the receiver receives the action differently. So if I think that 3 feet in between me and the person I'm talking to is comfortable, but they want me to be beyond 6 feet, I think that more is his question. Jose, is that? Oh, he said Val's correct.
Well,
Okay, so yeah, in that kind of a situation, then what I always go to, especially when I teach sexual harassment courses, is be conscious of what the other person is comfortable with. So if, for instance, I'm fine with 3 feet, but the other person across the room from me wants 6 feet, talk to one another. You know, I'll go back to communication being king, especially between employees, and finding out what both persons comfortable with, and trying to find that middle ground between the two of you.
you know, and maybe sort of going beyond this particular question. I mean, there's the questions being floated, whether it's in DC and Congress or up in Tallahassee, as to, employers' liability. What happens if somebody comes back to work, or a customer in the workplace, somehow gets sick because of COVID? We don't have an answer to that right now. Is there legal liability on the part of the business or not? So I think in absence of a specific question with regards to a law or a court case, you just have to follow, reasonable care and follow the guidelines as best you can with keeping the environment safe and clean.
Thank you. Great point. I'm curious, and I know we've had some questions around this as well, but should temperatures be taken prior to returning to work, or how do we address the temperature check, situation?
I can chime in on this one again. So this was, at least in my opinion, a little radical of the EEOC to do, but the EEOC has actually issued guidance stating that doing temperature checks is fine. Now, the temperatures that you get from the employees themselves are still protected by HIPAA, so you cannot share that with the rest of the employees. But if a business wants to mandate doing temperature checks as employees begin to return to work, it is perfectly acceptable right now.
And I can help with that question as well. From a risk perspective, a clinical risk, with infrared thermometers now, there's essentially no risk of any type of transmission from that perspective. And temperature checks are important because a lot of people have seasonal allergies. So you may have someone cough and sneeze occasionally. And a temperature check will help differentiate someone that essentially is coughing and sneezing maybe because of a seasonal allergy versus something more significant like COVID-19 or the flu.
Good to know. What do you think about, are you able to ask questions about, have they had exposure, or can you do a questionnaire about, how they've been feeling, or test results? What do you feel about that?
So the CDC guidelines actually has specific questions that they recommend that employers will ask either their customers or their employees when they come back to work. One is if they've had specific clinical symptoms. Those symptoms are coughing, sneezing, congestion, or shortness of breath, as well as fever. So a combination of 2 of those would spark concern that that employee should not come back to work. Number 2 is, have you had direct contact with a person with COVID-19? And number 3 is, have you traveled recently within in an area that is a hotspot for COVID-19? Now, that third one now is essentially been mitigated because it's all over the U.S. at this point. There's some areas like New York, Miami, where it's a little more significant, but the first 2 options, for instance, the hospital, everyone that walks in the hospital, whether you're a patient, doctor, nurse, technician, gets those questions, gets their temperature check every single day.
Okay. Thank you, Dr. Chris. And I'm going to leave this open as well. Should a business require customer liability waivers?
Maybe we should have had a lawyer.
Yeah. Require is a tough question. I mean, first thing, I wonder how, again, I'm not an attorney, but I wonder how well the liability waiver stands up in court. I go back to what I said earlier. I think we're gonna need some guidance from our legislatures to sort of be specific as to, where liability stands. And it's probably gonna be in relation to due care. I see on here the chat, Brooke asked, is there legal liability if there's no way to track who gave someone COVID? tracking is one of the questions. Contact tracing is one of the things that needs to come in place to be able to, try to arrest COVID ahead of a vaccine. So contact tracing is going to come along where it can be traced back to the source. So I go back to, we just have to be careful and just do what is reasonable with regards to protecting the workplace, to reasonably keep employees or customers from getting sick. And I also see from Beth Cahill, there's a question of, is invasion of civil rights. I know with regards to getting on airplanes and cruise ships, they're doing medical checks before people would get on board. So in those situations, trying to protect the general public, I'm sure those types of rules can apply across all sorts of businesses.
Yeah, and I was recently on a call, talking about a lot of these things, and I think that a lot of the questions are valid, but like Troy said, we really need to know from legislation, what's going to be required by, policy and whatnot. But the state of Illinois has made it law that it is the employer's responsibility to ensure a safe workplace. Now, what that exactly means, I don't know. I haven't had an opportunity to actually do research on that. But, once one state starts something like that, others will follow. So I think that the real answer for us here is getting ahead of the game, and create an environment where we can mitigate the risk of excessive transmission.
Thank you, Valerie. And Troy, since you were just talking about that topic, whenever you have an on-site service provider come on site, like an internet company or a cable service provider, what should you be looking for whenever you have someone coming on site from the outside regarding employee safety?
Great question. I honestly think it's going to, I'm kind of a broken record on this, but I think it relates to reasonableness. I mean, whatever policies you have in place for your employees with regards to whether they're required to wear face masks, wash your hands regularly, social distance, and keeping their hands clean, hand sanitizer, you can have that same requirement for contractors. In essence, they sort of become pseudo employees in that environment. So you need to require them to follow those same procedures.
Thank you, Troy. Does anyone else want to add in on that? Yeah, I think just following the same procedures as your employees do with the sanitizer and, all the precautions would be, my thoughts.
Well, I guess you're paying them for a service. So if they want to get paid for that, follow your company's guidelines. If not, I'm sure there's another company that will be happy to take on that gig.
No, that's a good point. So best practices for returning to work with the intent of avoiding lawsuits. What should those best practices be?
Well, I think that, like I mentioned earlier, start with, since there's no official policies, legislation from our local and state government for that, is following the CDC guidelines. And I'm sure Dr. Chris can, expand on that, but make a plan, implement it, and schedule regular maintenance program to make sure that the area stays as clean and safe as possible.
Yeah, I'm in agreement. The CDC does have specific guidelines to help guide businesses, and as an employer, you're going to have to adjust those guidelines based on the type of business you're in. Obviously, an office-based business will have different, with mainly administrative personnel, is going to have different needs versus someone in retail. So it's a matter of adjusting your infection control practices just to protect your employees as well as your customers.
Thank you. So I think we have time for another question or so. How are business owners approaching the return to work era? So now, that things have changed from before, how should business owners be approaching this?
Approaching it cautiously.
Exactly.
I'm kind of answer that, and I want to sort of answer Jeremy Lavin's question the same way he asked about regarding temperature checks. How should employers handle bottlenecks? When they're checking their employees for temperature or whatever as they come in. This goes back to what I opened earlier with by talking about post 9/11. In the beginning, there's that understanding, but you're now back to employee experience, and not creating frustration every time they walk, in and out of the office. Unfortunately, a lot of our answers aren't going to, come in this hour-long session. Each business needs to, frankly, plan and think and go through the strategy of how do we handle issues like this? How do we handle the bottlenecks? How do we handle the employee who doesn't want to wear the mask around the office if it's office policy? These are all, let's call it points upon the employee journey, points upon the customer journey of interactions with businesses. And a lot of thought needs to go into, how do you handle this and how do you handle that? Because again, Jeremy asked a great question. Not only are you creating bottlenecks as people come into larger employers, but how do you discreetly pull an employee out of line if their temperature is an issue without embarrassing them, without creating some sort of situation? Planning, thought, having procedures, going through a full methodology is something that I would recommend that you spend with your management team, or self-serving, call in a consultant to come help you. Go figure out what those policies and procedures should be.
As a hospital, we're actually doing all of this, and we'll have roughly 500 people come in a 30 to 40 minute time span, checking their temperatures, and we actually have specific processes so that if someone does, for instance, fail the questionnaire or have an elevated temperature, we have to have a dedicated path and space where they could be further interviewed with subsequent recommendations. So it's possible, but it certainly, as Troy said, it takes a certain amount of planning.
And I would think that hospital employees are a lot less sensitive about the privacy of, if they have elevated temperature or whatnot. But a couple of questions I saw in the chat was, if a temperature, or if they do start taking temperature, are they going to be required to track that? And then does it go against the individual civil rights? And I think that particular question was already answered. But how do the hospitals manage and track the temperatures, Dr. Chris?
No, so we don't track. We only reiterate the temperature to the individual that we took the temperature of, and that's it. So there's no tracking mechanism. There's some HIPAA concerns there, so it's only between the screener and the individual.
Thank you. And then I think that, Troy, this would be a good one for you too, if you want to add anything to that. If not, that's fine.
Well, I kind of
sorry, Taylor.
Oh.
Taylor.
Yeah, flexible start time is certainly something that I have a few of my clients doing right now to try and address these exact sorts of things. I'm also highly recommending, if a remote work environment is working for your company, keep doing it. I've had a few clients come up to me and say, you know what, we're actually going to cancel our lease to end of the year. We're getting rid of our office space. We found out we don't need it. And then as Dr. Chris said, for my clients that are taking temperatures, do not track that information. As he stated, simply share it between the person who's being tested and the one who's taking the temperature.
Yeah, I know it's not the subject of this call, but I've been talking with friends and questioning the future of commercial real estate. I think some employers, in sort of to Taylor's point, a lot of employers are out there are looking at how effective they're getting things done with employees working from home, might look around and say, you know what, we've got 1 million square feet. We don't need 1 million square feet. Maybe we need 500,000, or, you know, significantly downsize in the future. So I think commercial real estate might be dealing with some softness in the not too distant future.
And that's so true. Someone else mentioned also creating separate entrances just to eliminate the traffic, which is a great point as well. And then someone else asked, how does one simply cancel their lease for the rest of the year? I don't know if anyone knows this or wants to say anything about it, but I'm sure people are doing it a lot now. So
That might be. I mean, I misspoke when I said cancel. I just meant they're not going to renew their lease for the next year.
Okay. Well, I think we had some great questions today and some great discussion from our panelists. If there's anything else that's, you know, any other important information that anyone else wants to add in before we head out or do some networking, then
if I can just comment about the supplies one more time. Another challenge with getting like sanitizers and stuff like this, and I'm sure Dr. Chris has probably experienced this firsthand, is that in the PPE industry right now, you have to purchase in volume. So I'm a small company and I have to purchase 1 million of something. That's a lot. And so the folks that I'm getting it from are requiring either half payment up front or a whole payment up front in order to just place the order. So that right there is also causing another bottleneck in trying to get those supplies to market, whether it's hospitals and, you know, government entities. Like I've been trying to work with the FDBA, the Florida Department of VA, their nursing homes to get them supplies, and thereby, you know, they're not permitted to make those upfront payments. So trying to get them supplies has been extremely difficult. So imagine if we can't get our hospitals and our, you know, VAs the supplies that they need because of the volume and the cost. Trying to get it from Publix or the dollar store or wherever you buy your supplies is also very difficult.
Hey, Stephanie.
yes, Bridget.
I wanted to ask a question. John Coster actually posted this. He said, I have a customer in New York City who wants our instructors to teach a class in person in mid-May. They're asking for a copy of my official policy. I plan to tell them that we will follow the official guidelines of the Governor of New York and the Mayor of New York City. Does that sound good? In addition, I don't imagine I can force an employee to go there if they don't want to. Is that true? Taylor, can you answer that one?
So following the CDC recommended guidelines is definitely up there. I will highly recommend to put together your own dangerous pathogen policy. It's something that my clients are preparing to do as we return back to work, just so that you can be prepared for this to potentially happen again in the future. But as far as forcing the employee, I will go back to, you know, empathy if possible. If I would say that if an entire contract is relying on this person going there, you may have to force them. You know, at the end of the day, maintaining the business, keeping the doors running is always going to be the main priority. But if there's some sort of alternative to do that training, even in a situation like this, doing a Zoom type meeting or doing a Zoom type training, I'd certainly push for that too.
So
Taylor, correct me if I'm wrong. I mean, and yes, I agree with you in using empathy and communicating, but if from what I've been reading, really only ADA related issues can be used as a requirement, or should I say a defense of the employee can refuse to come to work. After that, they're required to come to, if as an employer they're required to come in.
Yeah, no, you're entirely correct. Unless there's some sort of protected reason that they can't come into work, then yeah, officially there is a requirement that you can tell them to come in. And if they don't, then I would recommend you follow your progressive discipline process that you have. But at the same time, if you push too hard and that person ends up leaving the company over it, it's very much trying to balance that.
Got it.
Yeah, that's very good to know as employers, for sure. I didn't mean to hijack your meeting, Stephanie. I'm sorry. I thought that was a great question and something that was important to put out there. And I didn't know that we could require staff to come back to work. So that's great advice for the business owners and people on this call who are leading teams, for sure.
No, definitely. I was just reading the question that Troy just sent in. If we want, I don't know if we have time for one more, and then just do some networking. Yeah.
You ask one more and I'll ask one more, and then we'll let everybody network.
Okay, sounds good. So Troy asked, we actually have been working with another company engaging non-touch temperature reading tablets that are on a stand. Is this part of a process you can implement as the new norm? This would avoid calling anyone out, more or less, by having a checklist of requirements before walking in each day, which sounds like a good idea. One of these requirements is not showing a fever. Thoughts on approach and legality?
I can jump in again here on this one. In the short term, with the EEOC's guidance that doing temperature checks right now is fine, I'd say on the short term, proceed forward. But this was very unusual for the EEOC to allow this. Typically, doing some sort of medical check in this kind of a situation was highly frowned upon in the past. Of course, there are some exceptions. So it's something that in the short term, yeah, you can certainly consider that, but I would highly recommend to keep a close eye on the CDC or the EEOC guidelines as we progress further away from the COVID-19 situation.
Thanks, Taylor.
I wanted to ask Dr. Chris, is there anything that we should have asked that we haven't asked as employers, as people leading teams? What do we need to know that we're not smart enough to ask the question about?
No, firstly, I think the questions that were asked are very good, and I think we've probably covered all the topics that would concern a typical business owner that's getting ready to open. I think the biggest hurdle that everyone's going to have to go through is the fear of coming back, and actually beyond that, the discrepancy and the people feeling the fear. Just like Troy mentioned earlier, there seems to be a bell-shaped curve where you have some people who are terrified to step out of their house, and then some who frankly feel that this is overblown and are going about their day like nothing's going on, and trying to mitigate those two factors is probably the trickiest part. But in regards to everything else, I mean, I think everyone did a pretty good job in regards to their questions.
Awesome. Well, you guys did an amazing job, and we knew you would. And we also knew this was a topic that a lot of people were going to want to hear more about and have tons of questions. As Jason shared early on, we came back to work on Monday and couldn't be happier to be close to each other and be in the same space. And we did have our office sanitized, and we went through a lot of different protocols to make sure that everyone felt safe coming back. But I think we've all figured out that we like people and we like to be around people, even if sometimes we say we don't. And I just really appreciate you guys spending your time with our audience and delivering your subject matter expert advice, which we always appreciate. Again, our sponsors were NextPath, Insperity, Largo Medical, which is an HCA property, Luminary Global, and Stonehill. And all of you did just an incredible job, so thank you. And now everyone get some wine, and if you want to hang out with us, last week they hung out for another hour and a half afterwards.
Oh, wow.
Yeah, so feel free to stay and network. That's a great part of what TBBW is proud of, that we do well, is connecting people and offering unique networking opportunities. But thank you guys very much for your time and for your partnership. And you are released if you would like to be released.
Thank you.